welcome back to my channel, and today I have a really special guest with me. This is my doctor.
Hello, I'm Dr. Sergio Verduzco.
And today we're going to be filming the long-awaited Q&A video that you guys have been dying to see. We had already previously filmed this video, but unfortunately the audio was really bad, so I didn't want to upload a crappy video because this video is super important and you guys need to have your questions answered. So we decided to refilm it, so here it is, and today we're going to be answering surgery questions about my surgery or any other procedures that you guys have questions about, and he's going to be answering it all because what better than having the doctor here with me today. So if you guys have any questions about any kind of surgeries, just keep on watching.
Well, hello everybody, I'm Dr. Sergio Verduzco and I'm from Bioplastic Surgery. So yes, we're here to answer you all the questions.
Yes, a lot of questions. So the first question is, what are the requirements before surgery?
Well, the first thing is you have to be healthy. So if you're healthy, you have no weight issues, you don't have no hypertension, cholesterol and stuff, we're gonna need to do a blood work and also to interview you with the cardiologist. And then that's basically one of the first requirements that we need you to do a plastic surgery.
Yes, before I had my surgery done, I had to go to lab work to make sure I was healthy and that everything was fine before you go into any kind of procedure. What is the maximum of cc's that you can get injected in your butt?
First of all, cc's on your butt, that's basically something that we wish that it was all stay. So starting by that, we can measure something around 600 to 800. That's the average that it's applied in most of the girls.
How many cc's did I have?
You had 800
in each butt. And the next question is, can you still have babies after a tummy tuck?
Well, that's a really frequent asked question, which that actually the answer is yes, you can have kids. If you couldn't, that would not be a surgery allowed on girls. So yes, of course you can have kids, and you need to discuss that with your surgeon. If you're thinking about doing your surgery before having kids, we might want to use a special suture. So just start by that. Definitely the answer is yes, you can have kids. This
is one of the questions that I get asked the most is, what about me that I don't have any children? Why did I do this before I had any children? But I came to him telling him that I didn't want to have any kids at all. So that is something about me, that I don't want to have any children. So me going into the surgery was not something that I was worried about. So.
And of course, when you need it, you need it.
Yeah. This is a really important question, is, are your surgeons board certified?
Well, that's pretty good to ask. Of course, we are all board certified, so we will offer you the best service in each area. Of course, as the specialty, as the certification. So we do have more than 5 surgeons in our team, not all for body, of course, but also for nose, also for gastric sleeve.
Yeah.
So we are a big team, and yeah, of course, they all are board certified.
Yes, and you guys can also give them their number, right?
Yes.
What is it called?
Just by giving you the name, you can find their certification, but we will provide you everything. We'll send you the license, we send you the certifications, so you do your research first, and you know that you have to choose always what is better for you.
Yes, 100%. Make sure you do your research, ladies. I made sure I did my research in this place before I even came here, so it is really important to know that your doctors, your surgeons are board certified and that everything is safe around you.
Yeah, you could not operate in a hospital if you were not board certified, so it's always good.
Oh, I didn't know that.
Yes.
How much weight did you lose before having a tummy tuck and lipo? Me, I used to weigh 180 pounds. That is so much. I was super overweight, and before I had my surgery, I had lost 45 pounds, and that's when I decided to get my surgery because I had a lot of loose skin and excess skin, so I had to cut it off.
Yes.
How much is a BBL?
Well, that really depends. Of course, whenever you watch this video, you need to see the date. But that's that's around 3,800 to 4,500, even to 5,000. That's depending on how much area you want. Of course, lipo 360, that means we involve the abdomen, the waist, and the back, the lower back most of the times. And of course the BBL, so it's around 360. So you go through the abdomen and also the back and the waist. So that's about it. Any other areas are extra.
What was the areas that I got lipoed?
Basically you got lipo on the waist, also the back, the top and the lower back. Why do you got only those areas? Because when you have a tummy tuck, most of the time you cannot lipo the tummy tuck. So that's something important to know. If you had a tummy tuck and you have a little bit of excess skin or at least of excess weight, kind of, you're going to need a second round. So that's so you know.
We will be discussing a second round for me in a little bit, just so you guys know why this needs to be done. But I didn't know that once you get a tummy tuck, you cannot lipo, or it's not recommended to lipo the stomach area. So that's really good to know.
It's important to know that, because if you had a tummy tuck already, you might need a round 2, so contact us.
Yeah. Are lymphatic massages necessary?
Well, lymphatic massages, I would say post-surgical therapy is important. Why do I call post-op therapy? Because you're going to need to have a special treatment after the surgery. Having somebody draining your back and pushing the liquid out, that's something that you need. So post-op massages, of course, I wouldn't call any specific name, either lymphatic or any other kind of special name. I would say post-surgical therapy. That's something that it is necessary.
Yeah,
yes.
I feel like it's really important. It made a huge difference in my body once I started my therapy, because it just molds your body. It helps your skin reattach to your muscle. It was just like, I feel like it helped a lot.
So the answer is yes. Of course, it's important to have post-surgical therapy.
Yes. How much time do I need to take off of work after having a BBL surgery?
Okay, well, the rule goes like that. If you have a BBL, so lipo, I would say 2 weeks. If you have a tummy tuck, 3 weeks. If you have tummy tuck, breast, and lipo, 4 weeks. So basically 2 weeks.
Yeah, after the 2-week mark, if you guys saw my experience video, I was feeling a lot better. I could be walking around, moving around. But yeah, 2 weeks is pretty good time.
2 weeks for BBL, 3 weeks for tummy tuck BBL.
Is the location a hospital or a clinic?
Okay, the difference from a hospital and a clinic is how many rooms do you have, and also if you have a special rooms for kind of like intensive care or emergencies. We do work in a hospital. Why do we choose a hospital? It's because it's a better service, and of course it has more safety. So we do work in hospital INT.
Yes, I was at the hospital INT.
Yes.
What's the best way to get a hold of you guys?
Okay, well, basically the best way is to be patient. Of course, everybody likes to have their code really fast. We do work on office hours, so please call us the numbers. We would like to hear your voice, and also if you want to have a discussion about any special needs, we can do a video call, so like a FaceTime call. So that's basically, calling is the best way. Also sending us a DM would help a lot, so we can see the pictures and give you an estimate, and also give you a diagnosis on something procedure that we've done, or maybe helping you with it.
Everybody asks me all the time how I got a consultation with them, and I gave them a call. They gave me a date, and I came in, and the rest is history.
Yeah, that's the easiest way.
Yeah. What is the best way for consultation?
Also, the best way to consultation is to come into the office. And we know that it's hard for you guys to come sometimes when you come for a place more than 2 hours away. So what we do is we ask you to come in the morning so we can do the consultation. If you feel like having the surgery, we also take the lab work. So we have all the lab work, so as soon as possible you want to come down to your surgery. Of course, we have the clearance already done, so you don't have to come back another time. So basically the best way to do the consultation is live consultation in the morning.
In person, yeah. But what about the people that live out of state? How would they have their consultation?
Okay, the best way is to send us pictures, and if you need to speak to us, you can chat us with a FaceTime call.
Okay, that sounds
good.
Yes,
it's the best way, so we can get to meet you.
Do you guys have a recovery home?
What we do is we send you to a really good recovery home that we trust, and they will take care of you the whole time. So when you come to do a tummy tuck, and of course you don't want to come back to take the train, you stay here for 5 to 7 days, and it's an amazing experience. You also have vacations and surgeons sometimes, so
Yeah.
it's pretty good.
And at the recovery house, they have a nurse and everybody taking care of you, right?
Food, they drive you to the consultation, so we have all figured out. We also can send you a driver to pick you up in San Diego.
Oh, perfect. Yeah. So somebody said, hi, I live in Texas. How would post-op be possible?
Well, that's good. If you live in Las Vegas, what we would recommend you is to actually stay here for a few days if you're having a tummy tuck, so we can take the drain out before you leave. But of course, the follow-up will be done at home. We will send you to a therapist in Las Vegas. We have people in Los Angeles, people in Las Vegas, people in Arizona that will help us to do the post-op therapy that we mentioned before. So we have you covered. If you live in Las Vegas, perfect.
Yeah. If you're diabetic, can you still get surgery?
Of course. I mean, having diabetes doesn't mean that you are actually not healthy, but as I mentioned, only for healthy patients. So if you do have diabetes and you do not have good control, you're not considered actually a healthy patient, so we would not can offer you a plastic surgery. But of course, I have to mention that we do have a surgery that is amazing for that, which is the gastric sleeve surgery.
Yeah.
So if you're also overweight, you can think about that surgery. So it's always important, if you're healthy and if you control, you can always talk about having a surgery like this.
Okay.
Of course.
What are some things you have to do for maintenance, like dieting or certain exercises?
It's always easy when you have motivation. So as you have the surgery, you always look good. So you always want to go to the gym and push yourself a little bit more.
Yeah.
So yes, you do have to follow the rules, always eating healthy, exercising, resting fine. It's really important to do all those things combined.
Yeah, when I got my surgery, they had previously told me through that whole month, it's better to not be eating sugars or any kind of fat. So that's what I did, and I was able to lose like 15 pounds just that 1 month that I was taking care of myself. I recently just started going back to the gym, and I'm not focusing too much on cardio, but more on the muscle part, so I could, you know, build my body up and make it look better. But definitely exercising and dieting is something that you have to maintain, or else your body's just gonna go back to the way it was.
Yes,
so
of course.
It's really important to maintain yourself. So the next question is, what is the difference between a full tummy tuck and a mini tummy tuck?
That's a really good question. Actually, as you see some pictures, everybody would think that a mini tummy tuck is a short incision. But no, that actually means that we're not touching anything on top of the belly button. So having a long incision without touching the belly button, that would also be a mini tummy tuck. So what it's a mini tummy tuck and full tummy tuck, basically the difference are the scar, of course, that's red, that's something subjective. Also, the way that we treat the belly button. If we go on top of the belly button, it's a full tummy tuck. If we go under the belly button, it's a mini tummy tuck.
Oh.
And also the muscle repairs. So a muscle repair will always be on the full tummy tuck. The mini tummy tuck will not include the muscle repair. So if you girls are thinking about doing a mini tummy tuck, it's not always the best option. It's only an option, of course, if you didn't have no kids, you have not that much excess skin, that's probably an option for you. But always the full tummy tuck is the real tummy tuck.
And the prices are different as well, right?
Oh, the prices are really similar actually, so I mean it wouldn't make a difference. So
just better get a full tummy tuck.
You better have a full tummy tuck, yes.
Where are you guys located?
So where are we located? We're located really close to the border from San Diego to Tijuana. So we're basically crossing the border from San Diego. We're 5 minutes away. So we're in Tijuana, Baja California, Mexico.
And you guys are in the Cosmopolitan Tower?
Yeah, we're located right here. Yes, in the Cosmopolitan Tower, doing consultations. We're located in Hospital INT doing surgeries.
So I know a lot of people were asking me what recovery home did I stay in, and I didn't stay in any recovery home because I live in San Diego, so the doctor in the hospital was able to give me a pass to cross the border really fast. So like I didn't wait a single minute, I just went straight through, and I was at my house, so I did not stay at a recovery home, but they do offer the pass so you guys can go back home if you guys are from San Diego or LA.
So I want to ask you a question too. So how was your recovery?
My recovery was really good in a way because I didn't have a lot of pain. I thought that my pain level was going to be so much worse than what it was, and it wasn't. It was just very uncomfortable. It was really uncomfortable to sleep, but the recovery was amazing. Right now, I feel amazing. I have no pains, like everything is like A1.
Yes.
And I'm really happy.
Always you take 3 months total to recover, so that's important, so you guys know. So you already had a surgery with any doctor and you feel that you still want to see more results, just be patient, just wait 3 months and you will see.
When I got out of surgery, I thought I was going to come out looking so amazing, and no, I was really swollen. It was not a cute sight, but right now, like, the time goes by and it keeps getting better and better. So definitely being patient and taking your time with recovery is really important. 1 month post-op, I thought I was going to be up and running, like feeling perfectly fine, but right now at 3 months is when I feel the best. So it takes time. Of course,
it's a process, and it's a process that you work with 80% of the body.
Yeah,
so it's a lot of the body, and of course you have any other surgery and you think that you're gonna come out feeling great. Of course, you do have a surgery. You always gonna feel something, and it's 80% of your body.
And that's what a lot of people worry, that they see on the internet people just being recovered from 1 week to another, but it's a process. It takes a long time to recover, but you look amazing. So it's worth it.
Well, something you need to know, it's as much as you do, as much as recovery you need. So,
yeah.
Of course, if you have an amazing surgery, you need a little bit more time to recover.
Yeah. What is the BMI for BBL and tummy tuck? Okay,
well, the BMI, it's if you have no previous surgeries, your BMI has to be under 32. Okay? So if you have any on top of that, we will ask you to lose weight for safety.
Yes.
Right? So what happens is that if you having a BBL with a 32 BMI, the result will be not that much.
Okay.
Right? So that's why we offer you something else.
Can he do epidural instead of general anesthesia?
Of course, actually epidural is more for plastic surgery. So you actually, when you wake up, you still have no pain. So that's better.
Yeah.
So general anesthesia, it's only for a few procedures. So yeah, of course, we can do epidural instead of a general anesthesia.
How long do you have to wait until we do round 2?
6 months.
6 months is good.
6 months, yes.
I can't wait for mine. How many days do you have to stay in the hospital?
Well, actually, about the hospital stays, usually when we have a surgery like yours, any other surgery, plastic surgery, it's 1 night. When we need, we can stay for 2 nights.
Okay. Yeah, I stayed for 1 night and then I was able to go home, and I felt good. I had no pain when I left home. So that was really good, yeah. Somebody said, what's BMI?
BMI, it's a body mass index. It's a way to measure your body surface. So usually you will find the information really easy on internet, so you can calculate it with your height and with your weight.
Somebody said, do you do fillers and Botox?
Of course, that's actually something that we do very often here in BI Plastic. So we do use Botox and Juvederm.
I got my lips done by him. He's so good with lips, and I love them so much.
Thank you.
So yeah, a lot of people ask me too where I got my lips done, and this amazing man did my lips. Okay, so another thing that I'm really excited to tell you guys about is that I'm actually in the process of going in for round 2 BBL, and my doctor here is going to explain to you guys a little bit of why we're going to be doing this.
Thank you so much. Well, the purpose of doing a tummy tuck first and a BBL, it's to basically shape the body around it. So when you do a tummy tuck, there's always a little bit of fat left on the tummy.
Yes.
So we would like to go in and to actually take all this fat away.
So we're going to be showing you guys what he's talking about.
So we're going to move on into do a liposuction on the abdomen. We're also going to do these beautiful lines right here if she wishes. The edging, so like she works out a little. We're going to work on the waist even better. But the place that we're going to improve the most is the tummy. So the buttocks, of course, with the BBL, it will look amazing with the second round.
So that's what we're going to be doing, is just to improve it a little bit more than it already looks. So we will be doing this in a couple months, so be waiting for that video, because this video is going to be even more detailed. We're going to be taking you guys into surgery where the doctor is going to be able to explain exactly what they're doing to me, and we're going to be able to show you guys a little bit more in depth. than my first video, so hopefully this helps you guys out too. If you guys are looking for round 2, this will give you a little bit more information.
We're gonna do an amazing job. Basically, we're taking all the fat away, and that's all is going to go to your butt.
Yes. I want a little bit more, but yeah, I mean, I already feel and look amazing, but I feel like round 2 would be the icing on top. So
of course, you always have to finish good.
Yes.
Well,
and they did amazing.
Thank you so much, and we'll see you in round 2.
Alright guys, well this was it for today's video. I hope we answered your question here and you got a little bit more information about plastic surgery or my procedure. I know it's something that you guys really wanted to know, so what a better way than having the doctor here and answering it for you guys. I 100% recommend them. You guys know I am so happy with everything that they did to me, and you guys are loving it as well. So I really encourage you guys to come in, get a consultation, check everything out for your guys' self. And I want to thank the doctor. Thank you for being here.
Thank you so much. Well, thank you.
And I will see you guys in the next one. So if you guys are new to my channel, please don't forget to subscribe down below. Like this video.
Thank you.
Like this video if you enjoyed it, and I'll see you guys in the next one. Bye guys.
Bye bye.